We do not use power morcellation in our practice for removal of fibroids or uteruses. This is a power morcellator, and essentially what it is a motorized device onto a spinning, cutting blade. Power morcellation is done by laparoscopic surgeons, minimally invasive surgeons, and mainly by OB-GYNs to remove a uterus or a fibroid so that patients can go home with smaller incisions and the benefits of smaller incisions. The controversy is there are patients out there with cancers in the uterus that are undetected that are getting power morcellation to remove the uterus or of the fibroids, and it could potentially spread disease. Well, this is a small spinning blade. It's about that big, and it goes through the abdominal wall. And when you have a large fibroid, let's say that size, instead of taking out the fibroid through an incision the size of the fibroid, which would be that big, we're now using a little tiny incision, usually about 1 inch, to remove the fibroid by cutting it up with a round spinning blade. It's like an apple core. So that blade is put into the abdominal wall, and either the fibroid or the uterus are cut up through that blade. When you see that morcellator go through the apple, you begin to realize how sharp those blades are and how fast those blades are spinning. Not only can those blades spread a potential cancer throughout the abdominal cavity, but there's a significant risk of injury to surrounding organs in the pelvis and abdomen. There was a patient in Boston who had power morcellation of a uterus done, in which there was a sarcoma, a very aggressive cancer of the uterine muscle. And that power morcellation device, by a rapidly spinning tight blade, spread the cancer cells throughout her abdominal cavity.
Lately, we hear questions about power morcellation quite frequently because of the media coverage and the FDA statement against power morcellation.
The FDA actually put out a black box warning, which means that patients and doctors need to have discussions about what the ramifications of a power morcellator can be with undetected cancers. Now, the OB-GYN community is very concerned about that, and many OB-GYNs believe that they can do power morcellation in patients safely. There has to be a good deal of informed consent between the patient and the doctor to ensure that the patient understands when a power morcellator is being used.
We don't use power morcellations because we have developed techniques that are far safer and faster than power morcellation. For the LAM procedure, for example, the technique that we use allows us to remove the fibroids through small incision without the use of power morcellation. For hysterectomy, where power morcellation is frequently used for robotic or standard laparoscopic surgeries, we actually are able to extract the uterus through the natural opening and without using the power morcellator. When we talk to the patient, we explain to them exactly how the procedure will be done, and they can see for themselves that the power morcellation will not be necessary at all.
It's important for patients not to accept the fact that power morcellation can't be done and then move on to their OB-GYN for an open surgery. If research is done and the patient's looking out for their own best health and they find out the information, they realize that with a CIGC surgeon, power morcellation is never used and is not necessary. You don't have to worry about it. It's not part of our practice. You can feel assured you're getting an extremely safe operation without the controversies associated with that device.